Hi guys, we're still on SCA preparation. So I've got some of the sample cases that are available on the Rcgp website. So you can, these cases are available to everyone on the Rcgp website. I just want us to go through these cases together and see what we think about how we're going to approach these cases. So the first one, patient's name Stephen McLean. The district nurse has requested a call with the GP today. Instructions to the candidates. There has been an email from the district nurse dated today. And that email goes thus. Dear GP, I have just seen Mr. McLean as part of my routine visit to see his wife. He has had diarrhea for the past few days, so the nurse went to see Mr. McLean's wife, but then has noticed some concerns about Mr. McLean. He's had diarrhea for the past few days. He's afebrile, his tongue is dry, abdomen is soft and non-tender. Blood pressure is 120/70 sitting and 110/60 standing. All other findings are normal. His blood glucose from finger prick is 7. Very likely it's a random blood glucose. Urinalysis is normal with no ketones. I asked him to give you a call as he wasn't his normal happy self. Thanks, district nurse. So the patient's information. Name Stephen McLean, age 75. Past medical history. Type 2 diabetes diagnosed 10 years ago. Essential hypertension diagnosed 10 years ago. On carer's register. Wife has dementia. So patient is a carer to his wife who has dementia. Patient's current medications. Metformin 500 milligram tablets. 2 tablets every morning and evening, so which means it's on 1 gram twice a day. Candesartan 8 milligram once a day. Atorvastatin 20 milligram once a day. Summary of attendance at practice. Patient attended the diabetic clinic 3 months ago. He was, at that point, he was doing well with no symptoms. Recent diabetic retinal screening was normal. Foot check was normal 3 months ago. His blood pressure was 146/82, but was stable. Still 3 months ago, his routine bloods showed normal electrolytes. His GFR was 55, so CKD stage 3. Has been at these for around 2 years, so stable kidney function. HbA1c 53, which is not bad for a diabetic. Liver function tests were normal, cholesterol was normal, and the plan 3 months ago was to continue his medications. But remember now, he's not himself, he's had loose stools, and he's just not his happy self. The questions for discussion and notes. Number 1. Is there any helpful information in the case notes to read before starting the consultation? For example, note the difference in blood pressures in the case notes. Is this significant? And if so, what should be done about it? Is this man at risk of an acute kidney injury? So let's have a look. Let's go back to the case summary. This is a patient who is having loose stools, who's been having diarrhea for the past few days. His tongue is dry, so he's dehydrated. The good thing is that he's not severely dehydrated. There are no ketones in his urine. He's not hypoglycemic or hyperglycemic. His random blood sugar is 7 millimoles per liter, which is acceptable, which is normal random blood sugar. His standing sitting blood pressure. So sitting is 120/70, standing is 110/60. So there's a postural drop, but it's not clinically significant. Well, it is actually. I'm not sure. Is it diastolic of more than 10? Is it 10 or more than 10? So actually, there's a difference, diastolic blood pressure difference of 10 in this case. So it's just at the borderline, at the margin of being significant. So the most important question would be, is this patient having postural hypotension or postural hypotensive symptoms? Is he getting lightheaded on standing? Is he getting palpitations on standing? You know what I mean? So if he's symptomatic, then that difference of 10 obviously is significant. If it's obviously more than 10 diastolic, is significant. For systolic, if it's 20 or more, I think it's 20 or more, not more than 20, then you begin to think about clinical significance in terms of postural blood pressure drop. So he's having some postural blood pressure drop. And then let's look at Mr. McLean's medications. He's on metformin. Remember the sick day rule. When a patient is unwell, not drinking enough, feeling generally rubbish, you need to be thinking about the sick day rule. He's on metformin. If he carries on being on metformin, he's at risk of having lactic acidosis. So we need to be advising him to hold. The good thing is that his random blood sugar is fine. So hopefully if he holds off his metformin for a few days until he's fully recovered and well hydrated, his loose stools have stopped, then hopefully he can carry on safely on his metformin. Another thing is that he's on candesartan, which is an ARB. So with candesartan, because of the way candesartan works, there's a risk of this patient developing an AKI and also developing hyperkalemia as he's dehydrated. Okay, he's having loose stools. He's probably not drinking enough. He's dehydrated, so we need to also be holding his candesartan until he's fully recovered from this this diarrheal illness. For his statin, obviously he's at risk of developing side effects, complications like myalgia and what's it called, rhabdomyolysis. So we need to make that decision as to whether we want to hold off his statin or not. But the most important thing is we need to be advising that he needs to stay hydrated, and more importantly, he needs to be hydrated using diuretic. So he's replacing both his fluids and electrolytes that he's losing in his loose stools. If we think it's a non-infective loose stool, we can advise some loperamide tablets as well to hasten recovery. But we should be very careful with loperamide if we're not sure if it could be an infective diarrhea. So the most important thing here is applying the sick day rule, encouraging hydration, and of course you have to safety net that if he's getting worse, if he begins to feel really lightheaded, having palpitations, just not getting better in the next few days, he needs to get back to you. If he has any episodes of collapse, then obviously they should be ringing the ambulance. At this point, you might need to advise him to monitor his blood sugar every day. And if his random blood sugar is getting above 11.1 or getting above 13, for instance, he should be letting you know immediately. The next question here says, do you suspect a diagnosis of gastroenteritis? Yes, very likely a diagnosis of gastroenteritis. Is there a need for further examination and or investigation? If so, what is the urgency of organizing this? Well, we might need to check. We want to check his renal function, to make sure he's not already in AKI, because he could be in AKI, which is also making him begin to feel not well. So we need to do his kidney function, check his CRP and his full blood count. Because he's on statin, we might also include the liver function test as well to make sure he hasn't developed hepatitis from his statins. What should you decide or advise about his medications? We've discussed that the sick day rule, hold off medications that could potentially become dangerous because this patient is dehydrated. So hold off his candesartan, hold off his metformin. For his statin, I'm not particularly sure if we should be holding off his statin, but we need to discuss that with him anyway. What management steps will you suggest now? We've discussed that the most important thing for this patient at this point in time is hydration. So he can carry on having plain fluids, but more importantly, he should be using the diurolite after every loose stool. So he's replacing his potassium. We need to be getting the blood tests that are needed. We need to be safety netting. If he's not recovering, he should let you know if there's any episode of collapse, then he should be ringing 999. What are your patient's priorities and concerns? Are there any considerations in his social situation that need to be addressed? So he's a carer for his wife. His wife has dementia. So we need to be checking. Does his wife need to go into a temporary home, respite care, temporary residential care, whilst he's recovering as well? Or do we need to arrange carers to come into the home to support both his wife and himself until he is fully recovered? Then he can carry on, caring for his wife. And then thinking longer term, we need to find out, has he considered, a package of care for his wife? What will he do? What will he consider? Because he's 75, he's caring for his wife who has dementia. We need to find out if he actually wants extra support, in terms of a package of care, carers coming in and supporting both he and his wife. What flexible solutions might you offer for him and his wife? You can always offer to speak with the social prescriber at your practice. So the social prescriber at your practice will usually be very helpful in terms of signposting Mr. McLean to available resources, like the local care providers. So they can then decide if he needs government funding or if he needs to pay privately to fund the package of care for his wife. They can also signpost him to locally available services or that could help support his mental health as well, because he's at risk of carers burnout. So those kind of things, you need to be discussing those things. You need to be checking if he's driving and how has he been. Is he safe to carry on driving while he's unwell? Bearing in mind that he's 75, you need to be thinking, is he driving? Is he experiencing disease episodes? If he's feeling dizzy, you advise him not to drive until he's fully recovered. The purpose of this case is to assess and safely manage an acute illness in a vulnerable patient with diabetes, on whom his wife is dependent for care, to recognize the medical risk, including possible kidney injury, the need to stop medication temporarily, sick day rules, and advise the patient regarding self-care, including rehydration, to consider his social situation and priorities, while ensuring safety of next steps, including follow-up. So very important, arrange a follow-up. Review him next 2 days to see how he's faring. Review the blood results, discuss further care if needed. If this stool is not improving, he's not recovering from the diarrhea, then you need to send a sample to the lab to make sure to confirm if it's infective or not, and if it's infective, what bug is causing it. Is it bacterial? Has he developed giardiasis, for instance, which is a parasitic gastroenteritis? You want to find out if he's not improving despite staying hydrated, especially with both plain fluids and diurolite. Cheers, guys.